So the idea of Tucson Wellness is to cure. We're searching for a cure, not relief. And I think when you have that model, you need a comprehensive team. So we use 7 components. We have a cardiovascular specialist. We have a medical nutritionist. We use Eastern medicine, Western medicine, medical nutrition, science, and then genetics to try to create what we call precision medicine in a sense. And that requires a team that does not have the ego, but is also willing to use other modalities or other forms of care and combine it to what we call comprehensive care, right? So you have a model and a system that depends on not just one philosophy, but multiple philosophies for healing. And in a case of we call comprehensive is typically for our pain relief or our longevity programs. And it always starts with our foundation of medical nutrition. And that's based on someone's advanced lab work. And then we have a biokinetics coach, and that's based on what I call anatomical alignment, just getting the body to be symmetrical instead of asymmetrical. So if someone has a knee pain or knee problem, the idea is to evaluate that first, then see Dr. Miner for whatever procedure we have, PRP, ozone, A2M, cellular tissue, Wharton's jelly, any of those in conjunction with the healing process. Then we use the diet as a foundation to make sure inflammation remains low, and then they follow up with the biokinetics coach after all of that to see if their body is aligned so we don't have more injuries. We always see someone with a knee injury, later on they'll have a back and shoulder injury as the body just becomes, as wear and tear occurs. And it's a little bit different for comprehensive care because we use those 7 experts to make sure that the client has the best chance of a cure rather than just relieving the pain.
I'm going to steal a saying from one of my mentors from Sports Fellowship, and that is our goal in medicine really is to put ourselves out of business. If we're doing all the right things, we're keeping people healthy, they won't need us in the future. Granted, injuries occur, arthritis can't be completely stopped. People will still always get injured, so we'll stay busy. But ultimately, our job is to prevent them, hopefully, from needing to come back as well.
Yeah, and a lot of clients won't listen, so they'll come back just on general, arrogance or like pushing the boundaries. And so we want clients to never come back, but we're our own dispensary. We have our own medication, so no one has to go anywhere. We have our own recovery facility. We call it cellular tissue regeneration kind of care. And so the idea is right. You don't want clients to come back, but they're going to come back because there's people who need care, but also who get injured by not listening. And then people that just want to have higher performance. So I agree with the mentor in the idea, but I think one of our goals is to change the way healthcare is done. It sounds optimistic, but it is, and we're seeing so much success here just in Tucson alone. We see over 12,000 appointments a year, and our space is around 1,300 square feet. And because the care is getting out there, and comprehensive care really embodies what our practice is about.
I know Western medicine, when we talk about preventive care, it's really preventive against cancers, it seems like. Like, let's do screening for cancer, versus in our setting, we're looking very basic blood work. What can we do to actually prevent some major chronic conditions, diabetes, chronic kidney disease, and all of these chronic conditions affect the musculoskeletal system as well. So,
yeah, I agree. I think Western care is heavily scientific on fixing stuff quickly for a quick turnaround. And it requires a ton of knowledge, a ton of education, a ton of schooling, obviously, for that. Then Eastern medicine is, 4,000 or 5,000 years old. So we rely on that to try to have that naturally process for things that have been lost through time. And by combining those two, you get such good results because one thing I noticed online is a lot of influencers, they come out the newest thing every day. There's something new, and they keep throwing new stuff out there, which isn't proven. And we focus on what is known, what is proven, and just perfecting that. And as those new things come, we'll continue to do the research. That's my job as the science officer, to keep researching what else is new, but only adding one component or two at a time the latest thing, the newest things for super healing or whatever. They're kind of trying to scam people with, and it just doesn't work that way. So comprehensive care is what's known, what's proven, and what's actually successful for the client.